So we're here with the DAISY-PCOS Leadership Program. This is a group of women who over the past year have spent time together doing training, participating in loads of workshops about PCOS, but also looking at things like media training and leadership skills. But they're here today to meet each other and to just share their experiences of what it's been like to take part in this Wellcome Trust funded public engagement project, which was awarded to DAISY-PCOS, who's the lead PI on the DAISY-PCOS research program. So you're going to hear in their own words what it's been like to take part, and what this has done for them and how they feel this program is going to change their lives and change the way they act and do things in the future.
So I've really loved having that sense of community with people with PCOS and just being able to have normal everyday discussions and learn a lot more about the condition.
Definitely meeting other people.
Other women like me.
But also people who have had different experiences.
People from different backgrounds.
They're not all cultures that I've had a lot of personal experience with.
Being there for each other.
Because that's really showed me sort of how varied PCOS is as a condition.
Like they're my comrades, like we've been through a difficult experience together.
We have a lot of very open conversations.
We've had training from DAISY-PCOS about the actual pathophysiology behind PCOS.
I've learned so much about how I can change daily bits of my lifestyle and how can that improve my symptoms.
I feel like I've gained a lot of confidence.
Confidence.
More confident.
More courageous.
Being able to talk about the condition.
We had sort of like media training.
Social media training, which has been really good.
What we need to be saying.
Because you can't really be a good advocate if you just don't talk about it.
Also as well, mental health first aid.
Because PCOS is something that can be isolating.
It just made me a bit more, empathetic about things that I may not experience, but they may be experiencing.
And this program has enabled me to really open up and share those.
And I've been keen to teach others what I've learned.
Partners or your parents.
So for the first time ever, I've been able to speak to my mum who has PCOS and my sister who also has PCOS.
Just feel more empowered.
Because I've been seeing so many other women and I just instantly relate to them and I was like, I'm here to help, we're all in this together.
It's been brilliant to meet up and coming doctors.
I'm a scientist, so we've had a workshop about science communication.
Science communication?
Learning how to talk about PCOS in a way that's not just clinical.
And how to communicate science with the public through art.
That people can easily understand what you mean.
Cartoons or videos.
Trying not to use jargon.
That really was eye-opening. I was like, okay, maybe I can do that as a career option.
And it's actually been really beneficial in my job as well. So it's kind of given me transferable skills that I can take beyond this program.
And that's really amazing.
It's improved the way that I interact with my patients who have PCOS, definitely.
And it's really exciting to know that there's going to be a new generation of doctors that will have a better awareness of PCOS.
Appreciation of things like intersectionality and how lots of different things can combine alongside healthcare is definitely something I'll take away from it.
I'd like to see more talking about women's health and PCOS in particular, and talking about it positively.
It also inspired me and a few other the medical students at the university to start a PCOS society. So that's something that was sort of born off the back of this program.
I'm just really happy to be, very glad, I found these women.
And having created a community, it has been so wonderful to learn from their experiences, to just feel very seen and very heard.
And also just sort of staying together as a group would be really nice.
I'm really looking forward to what 2022 will bring and being able to get involved in public engagement.
Our science is informed by what the patients want.
Workshops.
And the patients advise us also how we should target our science,
working with communities,
how we should design our research studies,
co-creation,
and helps us with the evaluation and determining the impact of our research.